All right, thanks, Carrie. Well, thinking it's time to smooth things over, it only takes less than a minute to do. Local cosmetic surgeon Dr. Joe Niamtu is here with his patient Heidi Drainoff to look at the benefits of Botox, courtesy of a live demonstration. That's right, Heidi's going to do it right here with Dr. Niamtu at the helm. Thanks for coming in, everybody. Appreciate it. Now, we were talking a little bit before we went on, Heidi, about being a before and after before. You've done this before for about 5 years.
Yes.
Fantastic. Now, Dr. Niamtu, people have heard of Botox, but you get a little bit of apprehension. Do you feel that when folks come in, or at that point, by the time they're ready to see you, they know what to do?
Well, you know, it's been around for a while, and of course it's administered with a needle, and so that makes some people apprehensive. However, we use very, very small, tiny gauge needles, and it's a relatively painless procedure. And I think you know, everybody in their first time is probably a little nervous, but about 100% of the people, when you're done with the injection, they say, "You're kidding, that's it?"
Yeah,
so
yeah. Much to do about nothing, almost, yeah. Now, tell us, for the beginners here, what is Botox?
Botox is a purified protein, and what it does, it's injected, and it takes about 72 hours for it to work, and it stops the muscle movement. So the most common areas that we use it are the frown area, the crow's feet area, and the horizontal wrinkles. And we inject several areas across that. And for instance, people that frown and have the deep creases here, which some people call the 11, all right? So you look in the mirror 3 days later and that's gone. The effect lasts about 3 months. And you know, many people will continue to do it. Some people do it once a year, some people do it several times a year.
Gotcha. It just depends, and it lasts about 3 months, you
Correct.
said. Well, let's see this in action. Let's not hold it up.
All right, we'll inject Heidi. What we're going to do is we're going to inject her frown lines.
Okay.
And frown once, Heidi. When people frown, they have these little creases in the middle, and so we'll prep that with a little bit of alcohol.
Okay.
And again, this is a very, very tiny needle. And what we'll do, it's just a small injection.
There it is. It's happening right
We're
now.
doing
Sorry, shouldn't make her smile.
That's okay.
Oh, it's all right.
Yeah, so you're relaxed, and obviously this is just an in-treatment or in-office treatment that can
Correct.
happen.
I mean, as you can see, it just takes a minute. So that is a typical Botox treatment. There are also some other new brands of this. Botox, of course, was the first, and there's a product called Dysport, which is very similar, and a new product called Xeomin, which will be introduced this year as well. But Botox has remained the most popular product.
So obviously we've had a little bit of a demo. You can see some of the area right there where it's been injected, but that comes down.
She has these little mosquito bumps here where we've injected it, and that takes about 10 minutes for that to go down. And you know, it's a lunchtime procedure, so a lot of people will come in, they'll do this, go back to work or back to play. So there's really no downtime or no recovery.
Is there a difference between men and women in doing this?
Well, you know, men have larger muscles, so they probably take a little bit more Botox in terms of the actual amount you inject. And other than that, it's a similar situation. And a lot of men do it. That's the other thing. That's a popular part of cosmetic surgery now.
Absolutely, and it's very simple to do. Now, if Heidi would come in and have this done, would that be it? And she would come back another day for, not that you have them, but you know, these little things that happen here? Or does all of it happen all at once?
No, we can do, you know, when Heidi comes in, typically we'll inject this area. We'll also inject her forehead and her crow's feet area. So the whole thing takes a couple minutes. And you know, whereas a large part of my practice is doing facelifts or eyelid surgery and things like this, the minimally invasive procedures have become so popular for everybody in cosmetic surgery. So a lot of people may come in and do Botox, maybe have their lips injected, and maybe have skincare procedures done as well. So you have the surgical side and the non-surgical side.
Fantastic. Well, thank you for being a beautiful demo today.
Well, thank you.
Yes, very much so.
Soon to be even more.
That's right. The cat's meow. Once that's smoothed out, we'll be all,
Watch out,
we'll be all set. Well, I learned something new today. I've never seen that done, so thank you very much for the demonstration. Looks pretty easy to do, wouldn't you say, Cheryl?
Wiping the ears right away. Thank you, Jessica. Thank you, Dr. Joe.